So this is how the kit comes from Belmar Pharmacy. Your testosterone is going to come actually in this vial. You just undo the top and basically set it to the side. Within that kit, though, you're going to get a bag of alcohol swabs. You're also going to usually get about 5 syringes with needles. The needle that it comes with, though, is already set up. This is the needle you're going to use to draw the testosterone out of the bottle. And then what you're going to do is you're going to change that needle over for a smaller needle. It's about a 1-inch needle to inject. And we're going to inject into the thigh, which is the easiest way to inject. If you're doing it all by yourself, it's really hard to inject yourself in the buttocks by yourself unless you have somebody to do that for you. And if you're going to do it into the buttocks, you actually need a little bit longer needle than these, but these are set up mostly for injecting into the thigh. So what we're first going to do is we're basically going to take your vial, and we're basically going to take the cap off like that. And then basically we're going to wipe it off with an alcohol swab. Set that to the side for a minute as we get a syringe out. And this next part is based on what dose you're told to give. So it's going to usually be anywhere between a 0.5 cc and a whole cc. So on the side of the syringe, you have 1/2 cc and a whole cc. So those are the two numbers usually is where we're going to start with every patient. And then we're going to basically change it up from there. So at least to start, that's where you're going to be. So we're going to inject 1 cc today. So you're going to put the needle inside the middle of it and then turn it upside down. And then basically draw this up. And it's a little bit thick, so it takes a little bit of time. And we're going to pull it down to about 1 whole cc. And this vial has a total of 4 cc's in it, and that's going to be good right there. So you're going to pull that out. She's going to basically then make sure that she recaps this without poking herself. And then she's going to take that needle off. And now she's going to exchange it for one of the other needles that comes. And we need to get all the air out of the top. So she's going to slowly push that up until barely all the fluid goes to the very top, and almost maybe a little bit of, you can see it out of the top of the tip of the needle, just barely. Right there, stop. So now she knows exactly where she's at. When you're doing this at home, you usually are not using gloves, but since we're here in the medical office, we're using gloves. And then what she's going to do is she's going to get an alcohol swab. And so we're going to inject into the anterior thigh. You got a bunch of big muscles in the anterior thigh, but people don't understand how much fat you have in your thigh below the skin. There's a lot of fat there. So a 1-inch needle will just barely get into the muscle. So we're going to basically put it into this muscle group right here. Okay, this one here, that's the one we're looking for. So first thing she's going to do is she's going to basically kind of grab, you want to do this in the mid thigh, you don't want to do it close to the knee. She's going to basically put some alcohol on it. And right before she injects, she's going to actually squeeze my thigh pretty intently so she can basically get this in right. Okay? So she's going to push real hard.
1, 2, 3.
And then she's going to slowly inject. This is thick, so it's going to take some effort. And then when she pulls out, she's going to really rub that for a second. Make sure it's really good. And then that's how we do it.